Hi, this is Daylene Barton with naturalfertilityinfo.com, and I'm going to share with you the wonderful benefits of Wobenzym N for fertility enzyme therapy. Wobenzym N can be found in our Natural Fertility shop under the Fertility Enzyme Therapy tab. This video is going to share with you 3 separate studies in which Wobenzym N was used to treat fertility conditions. So the first study has to do with immunologically induced recurrent miscarriage. So some couples, the woman's body has an immune response, so she can get pregnant. It's just that something in the communication between the fetus and her body, there's something goes wrong and it triggers an immune response, in this sense killer cells, to attack the fetus. Eventually the fetus dies and the pregnancy is aborted. So Dr. F.W. Dittmar in 2000 published a study that he did using 144 women who had immunologically induced recurrent miscarriage. And of those 144 women, 114 were able to carry to term and give birth to live, healthy babies when they used Wobenzym N throughout their pregnancy. Great results. It's a 79% success rate. So if you're a woman who knows that you have this condition, you may want to talk to your doctor about the possibility of using Wobenzym N throughout pregnancy. The study also showed there were no adverse side effects or toxic effects to the mother or the baby. So nothing adverse happened at all. All the children were healthy as well as the mothers. Now, when you have immunologically induced recurrent miscarriage, you're usually given a round of immune suppressing drugs depending on what the condition you have is. And these have possible side effects to the mother and the baby that are harmful. Another thing is those immune suppressing drugs are very expensive, whereas Wobenzym N used throughout pregnancy is very cost effective. Now this next study used Wobenzym N in combination with antibiotics for the treatment of pelvic inflammatory disease, PID. The same doctor performed the study, so Dr. F.W. Dittmar. He used 100 patients who had pelvic inflammatory disease with scar tissue present, inflammation, and pain. They used the Wobenzym with the antibiotics, so half of them used that, and then the other half used antibiotics with NSAID drugs, non-steroidal anti-inflammatory drugs, which are also anti-inflammatory drugs, so they help suppress that as well. But the study showed that only 6% of the women who used NSAIDs with antibiotics had a reduction in pain and inflammation and the pelvic inflammatory disease overall. So there were 57% of the women who were without complaints over time when they used the Wobenzym in combination with the antibiotics. At the end of the trial, 100% of the women said there was a substantial reduction in their symptoms from pelvic inflammatory disease when they used Wobenzym N, whereas only 73% of the women who used NSAIDs and antibiotic treatment were without complaints and felt that they were substantially improved. And that's a pretty good results. So Dr. Dittmar, in the conclusion to this study, determined that Wobenzym N enhances the body's response to the use of antibiotic drugs. And this is where this next study comes in. So this study was performed in Russia for couples who had, or men and women who had, chlamydia. And again, Wobenzym N was used in combination with antibiotics. If you have been diagnosed with chlamydia, which is a sexually transmitted disease, you're always treated with a course of antibiotics to kill the infection. Now, if it's caught early, that's almost always eradicated. Like if you found out you had chlamydia right away, usually it won't spread and the antibiotics treat it very well. If you're at more of an advanced stage, only 30 to 50% of cases there's no elimination of the chlamydia, and this can lead to chlamydia left untreated can actually lead to pelvic inflammatory disease, and pelvic inflammatory disease can lead to blocked fallopian tubes, scar tissue and adhesion, and infertility. So the first group who used just the antibiotics only had a 17.2 eradication of the chlamydia, and 72.4% still showed chlamydia present on their pap smear. That is just not a very good result. It's a little bit frightening. So if you're a person that's been treated for chlamydia with antibiotics and you're still having trouble getting pregnant and you would like to know what's going on, I would suggest getting another pap smear. It's something to think about. Chlamydia damages sperm as well in the men. It creates deformed sperm and the motility goes way down, as long as other wide variety of scary symptoms. And so women who had received the antibiotics in the Wobenzym had almost a 70% success rate, complete recovery. That's complete eradication of the chlamydia. The men had a 90% success rate using the Wobenzym N and the antibiotics. Great results using Wobenzym N. Now, because Wobenzym N is a systemic enzyme blend, it's also wonderful for eating away scar tissue, adhesion, uterine fibroids, ovarian cysts, endometriosis, any trauma to the abdomen. So if you've had a cesarean section and you know you have scar tissue or adhesions, blocked fallopian tubes. If you've had an IUD that was misplaced, or you've had previous abortion and you feel there may be something going on and you're wondering, Wobenzym N is great at reducing the inflammation, eating away the scar tissue and the fibrin and the adhesions, as well as detoxifying the blood. So something to think about. Now, to achieve results that you have to take it in an exact way. Fertility enzyme therapy has to be followed as directed on the product label for it to be effective. And here are some tips. You must take it on an empty stomach 45 minutes to 1 hour prior to eating anything, or 1 to 2 hours after eating a meal. The dosage needs to be spread throughout the day. So I like to wake up in the morning, take it as soon as I get up. Then I like to take it at some time midday where I know I haven't eaten anything or not a snack or anything, and then right before bed on an empty stomach. Whatever schedule works for you. You need to take it with 8 ounces of water, and it needs to be taken consistently over time. So Wobenzym is most effective taken 1 to 3 months consistently. People who are on NSAID therapy, blood thinners, heart medications, we do not advise that you use this kind of therapy. If you're somebody who's interested in using this into pregnancy, please go to the link below and print off the study that I talked about in the beginning of the video about using it throughout pregnancy, and talk to your doctor about this being an option for you. I'm also going to post other related links to articles that are important to study up on if you're wanting to learn the wide variety and benefits and to learn more about the studies I just spoke about. If you have any questions about how to use Wobenzym or its other benefits, please let me know. Please also let us know if you've ever used this product and you have any testimonials, if you use fertility enzyme regularly. And I hope all of you have a wonderful day.